I've always wanted to say this line. He needs no introduction. Chip Hart has been a regular presenter and contributor to our Business of Pediatrics sessions over many, many years now. And he's always sharp, entertaining, and filled with lots of interesting data, knowledge, and stories. And we actually have Chip as part of two presentations. He's going to chat initially about some experience and data about where we've been and, more importantly, where we should be going with the pandemic. And then he and Jan Blanchard will be providing some perspective on changes in coding and E&M services. So Chip, we have a break at 10 before the hour, and we're going to put the mouse in your hands.
All right. Can you see my screen?
Yep.
And you can hear me. So we're good to go. Thank you, Dr. Weissman. I appreciate it. Thank you for having me again this year. Sincerely, this is one of my favorite, if not the favorite, places and opportunities for me to present for a couple reasons. But the biggest one is the audience that attends this particular event every year is one of the best audiences in the country. And, I don't know how many people speak to more pediatric groups than I do, not many. But I'm just going to suck up to you guys for a minute, but it really is true. The questions that come out of the audience, the opportunities I've had to meet people, the diversity of your audience is fantastic. And there are a number of talks that I do for other for chapters all over the country that started here for me. Like the first time I ever gave this talk or that talk was here at Children's National. And so, you can feel mildly responsible for actually helping pediatric practices outside of the greater DC area. So anyway, I'm grateful and thank you. It's nice to be back, though not as nice as it has been in the past. I'm going to give you about 40 minutes right now on, I'm going to talk about what's happened in COVID, some of the lessons we've learned. I have the advantage that many of you don't, of being able to work with practices all over the country. And as a lot of you know, because I looked down the list of who's attending today, I've been doing what was a weekly COVID webinar with Paul Vincieri. We did it from March through August weekly, and then it went bi-weekly, and now it's monthly. It's again tomorrow night. And the amount of information that we've had and gathered and centralized is massive. And I'm just going to try to distill some lessons learned and perhaps some things for you to think about. I don't need to stand up here, sit here and say, oh, hey, I don't know if you noticed, but COVID happened. We all are dealing with it every day. But I wanted to maybe back out of the weeds a little bit and hit a couple key points that I think are going to be an issue for all of us over the next couple months or in the next year or two. So let's start at the beginning, okay? The first thing, I have to give my disclosure. I'm employed by an EMR vendor. I think everyone here knows that, PCC. Has no bearing on my talk today. And I will not be discussing any unapproved or investigative use of a commercial product or device in my presentation. Though I suppose if I mention the new COVID vaccine, I am, but I have nothing to do with that. So I'm not going to be focusing on that. All right, so here we go. Let's talk about one of the biggest lessons we learned from COVID. Our existing system is incredibly fragile. And I think this lesson is already lost. We've already in too many places moved past this key point that we need to remember. It took 2 weeks. March hadn't even finished when there were already calls for bailouts, that people were already being laid off, that unemployment was through the roof, that schools were being closed, that entire industries were being shut down. Our margin of error is so small. The ice that our entire economy, our entire medical infrastructure skates on is centimeters thin, millimeters thin. All right, I realize down in DC you don't skate on frozen ice, but we do up here. And so centimeters you can actually skate on. But the ice is too thin, and we have not prepared for not only we're not prepared for COVID, we are not prepared for the next COVID. And I'm saying this to you specifically because as pediatricians, you are one of the few parts of our entire economy and our entire social structure that is focused on preventing problems. Preventive care is what you do for a living. And we all, this community, the one that we're in, we are going to have to do more to prepare to prevent these problems in the future, not just to prevent the next COVID, but to prevent what happens when the next COVID comes. And I'm specifically saying that to all of you who've had significant financial impact this year, all of you in private practice and in the hospital as well. You know that you have been really careful the last few months, and every decision has a weight behind it that you didn't feel before. And we're going to have that. It's going to continue like that. There is no going back to normal. And I want to just emphasize that you are one of the few parts of our existing society that actually has a profound effect on what we rebuild and how we resew this fabric, especially because you focus on children. Okay, the people you're working on today are it's a cliche, but they are the leaders and they are the people who society it is going to be in 5 years, 10 years, 20 years, and you're really important. I'll get to that in a second. Another thing I'm going to mention, and we all know this, is that science is really hard. I think we have a headline every day that proves this. The fact that we have roughly half this country who doesn't even believe in science, or at least come to believe in what some people think is science. I'm not even trying to make a political statement. I'm just trying to say that this country really struggles with scientific issues, even though we're on the verge of what looks like a medical miracle with the vaccines. I mention this point because your role, one of the pieces, the place that you exist in our societal fabric, is to be someone who explains science to lay people, explains science to parents, explains science to the school system. You know, we just had Dr. Martin on here telling us about how the Virginia AAP is present in all these committees and all these places. That role that you perform, translating science to I don't want to say the word actionable because that actually means legal, but to decisions that can be made by committees and by school systems and by sports teams. That is so valuable right now. Your value as pediatricians has never been higher, but it's not easy. And I think we need to remind people that science is not something that is infallible. We all know that. But what makes science beautiful is the scientific method, and constantly improving and constantly learning and admitting when we're wrong and admitting that we've got a better way to do things. And that is a really important role that you play, is that middle person there. All right. So disinformation is a threat. Disinformation is a threat to us, not only as a society, as a culture, not only politically, but I think we pediatricians are on the verge of a precipice as it relates specifically to vaccines and specifically to the role that we all have to play in order to minimize the impact of COVID. All right, this thing right here, my mask that I wear to work, you are the biggest messenger for the use of masks nationally. All right, that's a fact. You, by wearing masks, you are leading by example, by explaining to parents that they must wear masks and their children must wear masks. You are, again, leading by example, and you are teaching people. But when the vaccines roll out shortly, the COVID vaccines, we know just by sheer volume of numbers, there are going to be events that are associated with a bad vaccine reaction, whether it is in fact a vaccine reaction or not. Someone's going to get the COVID vaccine and get hit crossing the street, and that's a SARS event probably, okay? The anti-vaxxers are unequivocally going to leap on any bad results from the vaccine. And I will further tell you that the pharmacists are absolutely already, the pharmacists, I don't want to say the pharmacists, the pharmacies, because there's a difference. The pharmacies have already, HHS already announced a special relationship with, was it Walgreens and CMS, or Walgreens and CVS, pardon me, to distribute COVID. They are coming after childhood vaccines. Make no mistake, that is absolutely unequivocally happening. And part of their position is that that pharmacists are the best positioned to give childhood vaccines. And that is wrong. They are hammering or chopping away at the patient-centered medical home, and your place in society as a trusted source, as the educated source, is under threat. And I want you to prepare and think about your role in that regard. This isn't all bad news, but these first couple slides, I just really want to wake people up. All right, now let's accept that March 13th, 2020 was the most revolutionary moment in modern pediatric history. Maybe I need to insert the word modern, okay? Because when antibiotics showed up, that may be bigger, maybe a couple vaccines, okay? But in modern pediatric history, there is no event that you literally can place on a date, March 13th, 2020. There's before and there's after. The rest of our lives will be post-COVID, not just in general, but especially for pediatrics. There is no returning to normal. PPE will be part of your lives for the rest of your careers. Telemedicine, which I'm going to talk about in a minute, will be part of your lives for the rest of your careers. Every conversation for the next couple of years will be colored by COVID. And it affects everything clinically, it affects everything financially, it affects everything socially. The sooner you accept it and embrace it and realize, I should maybe even make this my first slide, but the sooner you say that dividing line happened and I'm on the other side of it, the sooner you will be able to react and get to my final point, which we'll see in my last slide, okay? So one of the other lessons we've learned from COVID so far, pediatricians are the backbone of the country, period. You are doing so much incredible, important work. If pediatricians are how we're getting kids back into school, everybody agrees that kids should be in school. That school, the social aspect of kids being in school is vital to their long-term and short-term health. No one disagrees with that. Now, how to do it, whether it's safe, we can disagree on those facts. But any results that we get for getting kids safely into school are as the result of your work and guidance, okay? Kids being in school are a requirement for families to be able to work. And that very short chain right there, just those two elements alone, should remind you how important your work is to the economy, is to our mental health, is to the developmental health of children. I mean, I could just go on and on and on. The work that you're doing is the most important work in the entire spectrum of medicine right now. No one wants to say it. We all think about, well, there are people in the middle of chemo, and yes, the ER does incredible work. Of course it does. But the fact of the matter is, over the next 20 years, if we shut down all the emergency rooms for 3 weeks and literally tens of thousands of people die, it is not going to have the same economic impact as what happens if we shut down pediatricians for 3 weeks. If we cannot keep children safe, we cannot keep families safe, which means families cannot work, no businesses are open, and we've lost our future. So I want everyone, I should have a picture in here of pediatricians wearing capes instead of this one. Maybe I'll change my picture up. But the work that you're doing is so important. Don't forget it. All right, let me keep going. Preventive care rules. And why are pediatricians important? It's for this. Oh, there's a kid with a cape right there. All right. All of the practices. And if you've come to any of my COVID webinars, if you've read my blog, you know, because I've posted a huge amount of data on this, well visits are what is keeping pediatric practices open. And you've got to be depending on them right now. Well visits are how you get to keep an eye on kids. It's how you're doing depression screening and vision screening and hearing screening. It's how you're making sure someone isn't being abused or neglected. It's how you're checking in with the mental health of your families. That is so important. The work that you're doing there you've got to keep that up. And it's also the only way, especially as we roll into the winter, which is going to be tough. This winter is going to be really difficult, because you're not going to be able to see people out in the parking lot, or at least as easily, okay? People are going to be going back indoors more. We see rates are climbing everywhere. Even if people had been wearing masks properly and behaving properly, the rates are going to climb anyway because people are spending more time inside, all right? Their sick visits are going to drop, all right? Because people are not going to be not going to be infecting each other with all the other things that made up in the wintertime 30, 40, 50% of your visits. Actually, from once the school season well visits stop, I mean, I've shown you the data, your sick visits in January make up 70, 80% of your visit volume. That is not going to happen this year. So the only way you're going to stay open, which not coincidentally, is also the only way that you're going to keep your hand on your patients. So the only way you're going to be able to tend your flock in 2020 and 2021 is to get them in for their preventive care. All right, those two things go hand in hand. I'm sorry, I just entered a paragraph without an ending sentence. Sorry about that. But the only way that you're going to be able to stay open and tend to your flock is by focusing on preventive care. Now, I've got all kinds of presentations about preventive care. I've given them here in DC for you. You can go read them online, but right now, there are so many reasons why you should be combing through all of your patients and making sure you have seen everybody. And in a few short months, we will have been a year under COVID. You should have seen every single one of your patients by now, or certainly in 2 or 3 months, at least once. All right. And if you haven't, get on it. All right. Let me keep going. Telemedicine is here to stay. I didn't grab the data before I waltzed in here today, but I can tell you by mid-April, 40% of the sick visits being performed by pediatricians nationally were being done using telemedicine. And it's as things have returned to vaguely normal in a lot of practices, that number's down to, I think, a little bit below 20% right now. Nationally, somewhere between 10 and 20%. But they're here to stay. They aren't going anywhere. Those practices who have embraced, pardon me, I'm sure you can all hear the F-35s going overhead. So for the next minute, Freedom is going to fly overhead from our airport about 5 times. So forgive me. I can't control the Air Force. Anyway, the telemedicine, those of you who have embraced it, are generally performing better and doing actually better work clinically than those of you who have not. And the distribution of how people are doing telemedicine, even regionally, is pretty substantial. If you don't have a good telemedicine platform right now, and by that I don't simply mean you're on this vendor or that vendor. If you don't have a good microphone, if you don't have a good camera, if you don't have a quiet setup, it is time to invest in that. You invested in a waiting room. You invested in, you have a nice otoscope and maybe you have nice scales. Go invest in good webcams. Go invest in a laptop that's used only for telemedicine visits, if that's what makes sense. Go invest take one of your closets and turn it into a private space so you can have a conversation like that. Or I don't know what it's going to take in your location, but you need to make that investment. Telemedicine is here to stay. I'm also going to double down on the request from your 3 chapters to get involved in your chapters, because payment is not locked in. It's criminal in my mind how the insurance companies have not fully backed and embraced telemedicine as a rule. Yes, some of them have, but that's usually because there's a big stick behind them reminding them they need to do that. Every telemedicine visit you do saves them a huge amount of money potentially and makes your patients safer. So why they haven't raced to encouraging you to do telemedicine, why they've set up their own telemedicine programs to steal your patient interactions and to break your patient-centered medical home relationships. That's why healthcare is like organized crime in my mind. And so I think you should be embracing telemedicine and get your flock closer and keep an eye on people and talk to them, but join your local chapters so you can put pressure on your local payers to pay telemedicine at par and pay for those portal messages and pay for those phone calls. All right. That would go a long way to keeping everyone safe and keeping you engaged with all of your patients. All right. Cash flow planning is vital. Paul Vincieri, I should probably put a link in here. Paul Vincieri has talked about this quite a bit, and he actually has on the COVID forum that he threw up, and he and I sort of minister. He put a cash flow planning spreadsheet up there. It's free for everyone. And what I guess I'm trying to say with this slide is, you are in the business as pediatricians at helping prevent problems for the health of your patients. And I'm going to suggest that you should be preventing problems for your practice now. You are heading into the winter where I predict for many of you that your cash flow is going to slow down. The sick visit cash flow that you normally depend on is going to drop. So now would be a really good time to look at your cash on hand, make some guess about what the revenue is going to look like over the next 2 or 3 or 4 months, and figure out what expenses you have coming, what your payroll looks like. Sorry, that was the word I couldn't think of. What does your payroll look like? What are you doing for vaccines? Can you still get terms from your vaccine companies? Okay. What deal out there is the best for the vaccine companies? I will tell you, we just have learned about a Prevnar deal that at least one or more GPOs has just announced. All right, that's a big deal. We know that one of the pharmas has announced their own competitive. If you leave vaccine family 1 and come to vaccine family 2, you might save money, you might not. All right, that's another discussion for another day. But those kinds of business planning decisions are things that you need to do now. If it's even remotely possible that you're dealing with moving your office or hiring a physician, or if you are need to do some construction or anything that's going to affect your cash flow, now is the time to have that discussion. If you're in the middle of trying to deal with compensation modeling with your clinicians, now is the time to have that discussion. Apply the preventive care philosophy that you share with your patients all the time to yourselves and to your own practice. All right, cash flow planning is vital. For those of you who woke up in May and said, uh-oh, I don't have any money, I've got to lay some staff off, I've got to furlough a clinician, that's the worst. You've got all the reminder you should ever need that you need to have enough cash on hand to maybe float for 2 or 3 months. You have no excuse for doing otherwise right now. All right, so what else have we learned? The AAP, boy, I'm going faster than I intended. One of the challenges, as an aside, of doing virtual talks now is they go way faster than when you do them in person. That's I have to slow down a little bit. But anyway, one of the things I've learned. Please.
Yeah, it's okay to pace yourself. Actually, we have a little poll to do, just to have the practices sort of prioritize what their big issues are, so we can.
Okay, great. I'll just do my thing and. Yeah.
Before the Q&A, yeah.
Yep, and I also know that for real, your crew tends to ask really good questions, and I know in the past they've enjoyed grilling me up on stage, so I do welcome and look forward to that. So, in any event, this slide is not here because I am attempting to brown-nose Lee beers later today. The fact of the matter is, the 2020 AAP nationally, as well as many, not all, but many of the chapters, is not the 90-90, AAP or even the 2010 AAP. The AAP has stepped up. And I'll even say our friends at Children's National. I did not have to say that, all right? But it's the truth. The AAP has stepped up to support and defend pediatricians in a way that they have never done before. The last 6 months, I would have said this a year ago before COVID, but the difference since COVID is nothing short of revolutionary. The AAP has produced so many fantastic resources so quickly that it's almost like a new world order. The work that Mark Del Monte has done, and I'm giving him direct specific credit, but he would be the first to tell you that it's an army of AAP staff and hundreds of volunteers. Okay, the work that SOPAM does and COPAM does and all the groups that I know, it is mind-boggling. You have at your fingertips, if you've got payers right now who aren't paying the 99072, which many of them are not, you have a letter from the AAP that says, here's why you should be paying it. If you want to have a position statement about why pharmacists should not be giving vaccines to 3-year-olds, all right, which they shouldn't, you have an AAP position statement and people who will back you up at the AAP. If you want a COVID playbook, the AAP has it for you. All right. The work that the Academy is doing is amazing. And yes, I don't think it took COVID for this to happen. I think this was in play over the last couple of years for a variety of reasons. But COVID really catalyzed the effort that's happening there. And I've been really impressed with Sally Goza. I think we're going to have an easier presidential transition for the AAP this year. I am really looking forward to Dr. Beers, but she is being passed a very hot baton, as we know. But I think she has a support team that is more dedicated and focused, not only on the health of children, but on the required health of pediatricians than it has ever been. So leverage the AAP right now, and leverage your friends in your network and in your local chapters. All right, a couple more things. Medicaid is coming. There is no way to avoid the fact that we have millions of unemployed families right now who were not unemployed just a few months ago. And the special COVID-related payments to those families has run out or is running out. All right, COBRA is running out. People are not picking up jobs. Now, what this means is twofold. It's not just Medicaid, but let's talk about Medicaid first. So this means that if you do not take Medicaid in your practice, you are likely to lose some portion of your patient base because they can no longer see you. If you do take Medicaid in your practice, that means the portion of your families who are Medicaid is likely to grow. And to be clear, that's to grow from within. I'm not talking about people who are Medicaid, who are forced to leave their old practice and knocking on your door. That's a whole other layer of people. I'm talking about people who are presently on Virginia Blue Cross Blue Shield, who are patients of yours, who are now Medicaid and show up at your doorstep. And you take Medicaid and you take Blue Cross Blue Shield, so you take them. That percentage is going to grow. So remember this slide right here where I say cash flow planning is vital? You need to be prepared for your payer mix to be different. Furthermore, it looks like, and I say this subjectively right now, I don't have data, but it looks like there are many more families, where you have two working parents, one of whom has lost the job that had insurance, and both parents may still be working or only one of them is working, and that allows them to have too much income to be on Medicaid, but they are no longer covered by insurance. And that used to happen all the time 12 years ago, or maybe not all the time, but certainly 20 years ago and 30 years ago. I have the data. I presented it at the NCE. Okay. In the 90s, 50% or more of your income came from families directly. That number is now less than 10%. Okay. It's copays and some deductibles. Right. It's like the number is really small. The shift has gone to the insurance companies, but with people no longer being insured, you are going to have many families who are now cash paying families. They can't afford health insurance. They make too much money to be on Medicaid. Now, I believe the constituency of this particular meeting is surrounded by states who adopted Medicaid expansion, and so that is going to be less true than in those states who didn't. I posted some, I think it was a RAND study, or no, might have been Kaiser who did a study that showed those states who didn't expand Medicaid are going to have a massive or much larger population of uninsured families. But even those who did expand Medicaid are facing an increase. So you're going to need to think about what your practice looks like. This was not true pre-COVID. All right, a few more slides. This one leads right into this conversation right here. All medicine is local. I'm sort of forced to remind people of this routinely, because if you're on the SOPM list from the Academy, or you're on you are involved with a committee here, or whatever the case may be, and you hear someone make a statement that is so they place a stake in the ground and say, these are the facts. Just remember to temper them with your own experience. The way that COVID has affected our society, but also very specifically, the way that COVID has affected pediatricians has varied substantially across the country. Okay, I can tell you that COVID in April and May in New York and in San Francisco was very different from COVID in Arkansas during April and May. All right. And the inverse is true right now. COVID in South Dakota and North Dakota right now are not COVID in New York City, even though New York City is in no great shape. We know that these things are hitting at different places and different times, and culturally they're hitting differently. The way the insurance companies are hitting it's different. And so just remember, if someone tells you something that seems to be absolutely adamant, if their position is adamant, that may not be true where you are. All right, and then I believe this is indeed my last slide. So, Mark, I did pick it up a little bit. This is Louis Pasteur, who should be a hero to everyone here, and he had a phrase that's attributed to him, a quote that's attributed to him, which is, "Chance favors the prepared mind." Now, my dad told me growing up that Branch Rickey, the general manager for the Dodgers, used to say this all the time, and that was his quote, but it's not. It's Louis Pasteur, or Louis Pasteur. And the point I want to make here is, if we were in fact scientific, and if we in fact approached running our pediatric businesses scientifically, and I don't simply mean that from a mercenary perspective, but I mean that from the perspective of, we need independent and system level pediatric practices in place for our society to function. If we approached that concept with science, we would have been better financially and clinically prepared individually for COVID than we were. I'm not suggesting that anyone here was supposed to develop the vaccine for COVID. I'm not suggesting that anyone here was supposed to develop the national mask mandate for COVID. But what I am suggesting is, you've been given all the evidence you need to know that you need to shore up and build whatever bad analogy I want to use, build the moat around your castle, okay, to protect your practice in order to make it viable, all right, and in order for our entire society to stay healthy. Your mind has been prepared. You have all the information you need to know that this is important. All right. And there's no other evidence you should need. Now is the time to prepare for round 2. You are going into the fall, or going into the winter, I'm telling you right now, your winter 2021 is not going to be as stable as your winter was in 2020, last winter. So given that you know that, we should start here and say, all right, what do we need to do to shore up for December, January, and February? So anyway, that's my last slide. Thank you very much. I don't know if we have questions or not, but I'll stop sharing and we can go from there.
Thank you so much, Chip.
Yeah, thanks,
Mark?
Chip, for that overview. I must admit I've lost a little bit of my morning calm.
Yeah, you should have had someone come after me. Well, but I'm going to say, I think it's better to know that it's coming and to be able to prepare for what we know is coming than to just be surprised by it again in December, right?
No, agreed. And we were going to actually put this poll up before your presentation, but I was so eager to move on that we overlooked it. But can we put the poll up? So we're inviting our almost 200 attendees to, we're actually going to ask you to answer this question twice. You can check off all the things that are practice concerns for you at this moment. And then we're going to put it back up a second time and ask you what your biggest concern is. So check as many as are applicable right now before we put up the next poll.
You need a select all button. Now, yeah, I wish we'd had this poll before I'd gone. I could have tempered some of my comments. But now, would you like me to answer any of the questions in the Q&A while that's happening, or do you want me to wait?
Well, we should have these results pretty quickly, I think.
Okay, all right.
Yes. Where are we, Taylor?
We're going to give everybody about 5 more seconds, and then I'll go ahead and close the poll.
So,
interesting.
So there are, and now can we put it back up again and ask, the results may be mirrored by this, but
now
we're going to ask our participants to actually just rank for them their top 2 concerns. And Chip, while folks are doing that,
all right. I'll answer some questions. Sure.
Yeah, I would also.
Yep.
Yeah, I would also say that just to sort of recap, the data that you have from practices that you work with across the country are certainly informing, some of your perspectives and suggestions. I'm hearing that the social distancing, the kids being out of school, that the suggestion is that we may be seeing less of those sick visits, less of those virus spread type illnesses. So those sick volumes may not be there.
Absolutely true.
Plus, there's an opportunity around well child visits. So maybe it's worth sort of restating that just as a framework for planning for the winter.
You could not be more correct. There's no question. I would stake my career on it. There's no question that sick visits are going to be down. I mean, barring some other variable we don't know about. Sick visits have not even remotely returned to their regular seasonal values, period. And they are not going to anytime soon. And at least in terms of viral illness, which is the predominance of what pediatricians do for sick visits, between October and March, February. However, there's clearly a significant growing market for treating anxiety and other depression and other mental health issues in children. If I were in charge for a day and I could wave a magic wand, we as a community would figure out how to integrate mental health services in every single pediatric practice in the country, because you all need it. I mean, I realize I'd have to suddenly create a few 100,000 mental health clinicians to make that happen. But that is your future. There's no question to me. So right now, I have been in your large presentation hall there in Maryland and shown the slide. I can probably call it up here in a second, showing the normal well visit rates for pediatricians nationally. And my data sample is a select group of pediatricians who are, I'd like to say, a little bit cooler than average. So I think my rates are probably even better than what I think the average nationally is. And, it's half your teenagers haven't been in the last year. And if there's some event that has happened in my career in the pediatric space that should trigger getting a teenager in to check in on them, that's bigger than COVID, I don't know what it is, because they are isolated from each other. They are depressed. I mean, I have kids myself, and I know all their friends. We all see it. We all know it. So you have all the reasons you need to engage your patients. No, you should. It's not the same. It's not the same as doing otitis. All right. Right now, I bet every pediatrician listening right now would love to do a day of otitis visits because they're so easy. They're easy. They're fun right now. But that's just not going to happen. So stop pretending it's going to, and let's focus on what needs to get done. I will say this, and then I'll address the questions in the Q&A. I'm not at all surprised by the answers that are here. The one thing I'm going to give pushback to this group, the item that says provider burnout. Let me say this. I cannot empathize or sympathize more with that feeling. I totally understand it. I completely get it. There's fear, there's anxiety, there's concern that you are being turned to and you don't know what to do, and people are asking you to lead and you're not even sure what direction to go in there. I could describe the anxiety that my clients are feeling all day long. But here's the point I want to make. You don't have a choice. You don't. Maybe some of you do. Maybe some of you can retire. Maybe this is your sign that it's time to go do something else. But please don't, if you can. Stick around. The work that you're doing is incredibly important. COVID has reminded us that I don't even know what to call it, this straight up American dream. You go to school, you get a job, you have a great life, your family's happy and healthy. That is an incredibly fragile dream. And as clinicians, you know this for years. You've had subsets of your family families who did everything right, and some tragedy befell them, which knocked them off the ladder. And you felt bad, but you moved on. Well, guess what? Everybody's on this same ladder right now, and we've all been knocked off. And you, as pediatricians and the people who work for pediatricians, are among the few people in our economy, in our society, who have an opportunity to put us back on track, to get us back on the ladder. Your work is incredibly important. So I know you feel burned out, but please don't stop. We don't have a choice. We cannot do it without you. It is, our society will not get repaired without massive effort from pediatricians and those who support them, period. So I'd like to scratch the provider burnout one. Even it exists, it's real, but, and we should address it. We should do things about it, but it cannot be the reason that we fail. So anyway, let me answer my questions really fast.
Right, so we have about 4 minutes. Plus, we may be able to tag a little bit on after the next presentation. But let's try to manage that up before our break.
Yep, and like I said to Taylor, it would not be a Children's National event if we weren't 5 or 10 minutes behind. It's just the way every event always works. So, do I think there will be another PPP loan? Certainly not between now and the transition to the next administration. That's just not going to happen. And will there be one after it? We have no earthly idea. The timing of everything regarding the election and the transition, who knows? If I knew the answer to that, I would be betting. I would probably take all the money I have and put it somewhere in the stock market for or against. But I have no idea. I don't know if I want there to be another PPP loan. I think there might be some other mechanisms that would be healthier for pediatricians, but I don't know that the industry is capable of delivering that. All right, Chip, how do I think telewells are going to fit into our practice going forward? I hope we figure something out. All right, I don't know exactly. We do know that telewells. Oh, that's a great question. Telewells are happening in some parts of the country and getting paid. I almost wonder if the concept right now that we have in pediatrics of having acute visits and having well visits, if that is going to need to evolve quickly so that we maybe have acute visits, which might require hands-on visits, and we have well visits, certain types of well visits that do require some level of hands-on. And then we have this other kind of visit, which is a check-in, which is mostly, which doesn't require hands-on. Now, of course, a lot of those feel like acute or chronic visits, but they are, whether they're mental health or developmental and we all know when I say mental health, that's a huge umbrella. That includes ADHD, that includes, spectrum issues. Those things can be done using telewells, and often better, and certainly better for the patients. And so I think as a community, pediatricians ought to be screaming about this. And any pushback you get from the payers about, because literally I've heard the payers say this, we're not ready to extend telemedicine payments because we don't know how this is going to affect us financially. That's where I want to go. I want to go round up a posse because all the insurance companies have just had record profits as a result of COVID, and the amount of money we're talking about on our end of this work is budget dust. So everyone here should be screaming about getting telewells not only paid but figure out what they mean. What's a valid telewell? So that's that question. What is the vaccine family 1 and 2? What I said when I referred to that is I was referring to the Pfizer vaccine, the one that we expect to see first, December 15th, the one that requires super low fridge temps, and then the follow-up vaccine by the company whose name I just forgot, which doesn't require super low fridge temps. We know what little I know is that the Pfizer vaccine we should expect is going to be distributed to large health systems, to CMS and Walgreens, which ticks me off a little bit, and it's going to be delivered to frontline responders and to the elderly, people are in danger, who are particularly susceptible. And there's some practicalities to that, not only in terms of who's going to get it, but those Pfizer, what I've understand is the Pfizer vaccines are going to be delivered in lots of 1,000 and require special storage. And that is not something a 4-doctor pediatric practice is generally going to have. The second vaccine, which will be a few weeks later, does not have those requirements. So that's what I was referring to there. And of course, every single thing I just said could be totally wrong. I'm only trying to parrot some stuff I've learned. And lastly, what is this Prevnar deal? Is it covered through the Pediatric Health Network that we are using? I can't answer the question for your
We'll address that after the break.
That's what I thought you might say. And so
Okay.
That's that. All right. Did I get them all? Oh, you guys added like 20 questions.
So let's do this for time management, because I think we're coming up on the break. Leave these up so that, or we'll make sure that you can see what's there. But I think we're going to do our 10-minute
break right now.
Now.
Yep.
Let folks stretch or whatever, and then we'll kick it off with you and Jan at 10:05-ish.
Yep. Awesome.
And we should have a chance to sort of circle back on 1 or 2 of these, and the others we'll figure out how to send out via a different response route.
Well, would you like me to type answers into the Q&A?
Sure.
All right. I'll take a stab at that while we're doing things.
Okay.
All right. Thank you.
Taylor and Shadon, you want to move us into the break, and then we'll regroup in 10 minutes?
Sounds good. Thank you, Chip. Thank you, Mark.
Thanks, Chip.